When Congress returns to Washington, one of the first issues they'll take up is the state children's health insurance program. Why should Americans be leery of what sounds like good legislation? I'm Matt Straight, and this is Heritage in Focus.
This is not about taking care of poor kids. We already have a program that takes care of millions of low-income children. Really, what Congress is trying to do is to say, let's cover rich kids as well. This is a step towards government coverage for everybody, what they call universal health coverage. What's wrong with that? Well, if you want to have waiting lines, such as we have in England and Canada, if you want to have quality suffer, and if you still want to be paying for it through increased taxes, then I suppose you wouldn't be against universal health care. But this is not about taking care of poor kids. This is about taking care of rich kids. This is about using kids as pawns in an effort to expand government's role in health care. Right now, parents realize they have the primary responsibility for their children, not only for their behavior and their education, but also for looking after their health care. Once government says we're in charge of your kids' health care, then government makes those decisions. We already see that, for example, in family planning programs that government sponsors, where they say we're not going to tell parents what their kids may be doing if, for example, they're sexually active. Well, you have that same philosophy that's ultimately going to drive a wedge between parents and kids when government starts making the health care decisions for our children. As a father and as a grandfather, I don't think that's a good idea. The key is to make health insurance affordable so that people can afford it and that we have the same tax advantage whether I buy my health care insurance myself or whether my employer pays for it. Right now, unless you get it through your employer, you're put at a disadvantage. We also have a system where government is making health care so expensive. Government regulations are one of the biggest drivers escalating the cost of taking care of ourselves whenever we go to a doctor or a hospital. So we need to drive down the level of government regulation, and we need something like an increased expanded deductibility or health care credits that give people the incentives to purchase their own private insurance rather than be pushed into a government-funded program. After all, if you talk to people, for example, with the veterans health care system, you see that a government-run system has plenty of problems. I don't want that for our kids.
Clearly, Congress has some work to do. They need to put America's families first and make sure the government isn't in charge of health care decisions. I'm Matt Straight, and this is Heritage in Focus. For more information, log on to heritage.org.